Good morning and good afternoon, and welcome everyone to the webinar. My name is Mei Chu, and I am the clinical professor at the Colorado School of Public Health, and also as the interim director of the Center for Global Health. This is our research project that we are welcoming you to look at our goals and to provide a platform to discuss issues about biorepositories and sharing specimens as a public good. We believe that this is possible, and it will require the help and hope of many to make this achievable, but it's intended to help, as you will hear through a series of interesting lectures about some of the issues that could be barriers and that could be also be benefits. And I'm going to stop here and just welcome you again, and then hope you would join us on this continuing journey. We intend to do this annually, so that please stay with us and we can learn from each other. Thank you. I'm now going to give it to Ms. Zoe Steinberg to give you some housekeeping rules.
Hello all, thank you so much for joining, and I'm looking forward to hearing more from our speakers and from all of you in the discussion following this. So just a few brief housekeeping items. The webinar is being recorded and will be shared on the Global Health Network's platform. After this webinar, you can look for that there in the coming days or potentially early next week. In order to automatically translate the speech into subtitles in a language of your choosing, you may navigate to the closed captions function and select your language. Due to the number of participants, your video and microphone have been disabled. You will be able to see the speakers, but your video has been disabled and your microphone has been muted. Please use the chat function to introduce yourself. You may list your affiliation if you wish, or to report any technical issues. And please use the Q&A function specifically to post questions and comments. You may do so anonymously if you wish, or you may include your name and affiliation. With that, thank you very much, and I will turn it over to the presentations. Thanks so much.
Good morning, good afternoon, and good evening, everyone. I'm María Consuelo Miranda. I am a physician epidemiologist at the Universidad Industrial de Santander, Colombia. I am member of the Contagios Consortium, where I focus on the ethical, legal, and regulatory aspect of epidemic preparedness, including data and sharing samples. I have also had the privilege of contributing to the WHO R&D Blueprint for Epidemics program. Today is my pleasure to introduce you our esteemed panel of experts who will share their insight on the benefits and barriers to sample sharing. We'll begin with Dr. Judith Giri, PhD. She has a background in microbiology and immunology and has been serving as the biorepository expert for different organizations for over 20 years. She helped oversee the CDC's Central Biorepository, establish its institutional and regional biobanks, and serves on IRB's ethics board. She contributed to the editing ISBR best practice and to workshop on quality management and LC issues. She will give us the introduction of a robust virtual biorepository system and the 10x10 initiative, highlighting the potential benefit of such systems. Judith, the floor is yours.
Thank you for the introduction, María Consuelo, and thank you, Zoe, for helping with the slides. I'm going to give you a very brief introduction to the Virtual Biorepository System, and on behalf of the VBS team at Colorado School of Public Health. The concept of the virtual biorepository system is to improve epidemic preparedness by providing an equitable and transparent process for accessing samples. A lot of the information that I'll present has been published, and the reference is below here, and we can put it in the chat as well. The goal of the virtual biorepository system is to build a trusted, globally representative source of specimens, and importantly, associated data for diagnostics, vaccines, and research and surveillance. The need became obvious during the Zika and COVID-19 outbreaks recently, the need for a more durable, lasting system that can be activated quickly in emergencies. A unique feature of the VBS is that it is a distributed system with local management of specimens, but ensuring that the specimens are collected and managed according to specified criteria of quality. These are some of our partners: the Centers for Research in Emerging Infectious Diseases, CREED, PREMIS, the Pandemic Response Repository from the NIH, Find Diagnostics, the Global Health Network was helping us host, a Recoded project, and Contagio projects that the Contagio project will be described in a few minutes. We are also keeping others who have similar interest informed, like the World Health Organization, CEPI, and other collaborators. So what is the operating principle of this virtual biorepository system? Biorepositories are not static. They must evolve to meet the need of stakeholders and develop sustainable resources that provide long-term stewardship. One model may not fit all. So what is the VBS? It is a platform that helps connect contributors and users to meet the needs for characterized quality samples, provide reference materials, serve as a hub for templates, for training, provide information to allow us to facilitate quick exchange of specimens, and as I showed in the previous slide, align with other similar parallel efforts to collaborate with others who have similar interests. What the VBS is not, it is not a large facility for storage of specimens. The first thing that we did in the development of the virtual biorepository system was to gather information from stakeholders. And between 2020 and 2022, we surveyed a large number of different stakeholders, which included biorepositories, included all kinds of organizations, governmental and non-governmental organizations, as well as a few diagnostic manufacturers. And we had a geographically well-distributed number of responders. So from the survey, these were the survey we conducted, which was called Benefits of Contributing to a Virtual Biorepository. These were some of the results we obtained. And we asked, what would be the most important things for you as a biobanker or as a biobank from a virtual biorepository system? What would be the most important benefits to you? And on top, there are things like collaborations, helping with collaborations, capacity building, establishing the biobank as a reputation that it's a trusted source, and for individuals, ability to network, access to training about biorepositories, and publications were also mentioned. For biorepository operations, the most consistent information that got the need for standardization of processes, of SOPs and processes, and coordination of logistics. And coordination of logistics is really what the VBS is trying to achieve. Others were informatics tools and expertise for biorepositories. Next, please. We have also interviewed a large number, a different type of stakeholders, which included a few diagnostic manufacturers, and included also governmental, non-governmental organizations that have networks or provide services for biorepositories. And these were the gaps that they identified of being of high concern. Timely access to high-quality specimens, especially early during an outbreak, that was the highest concern, especially for small diagnostic developers. Availability of the right types of specimens and access to complete information. And this is a concern for those who obtain specimens, for example, from commercial sources. They usually do not have much information with them. And the need for samples and reference materials for quality assessment and validation. These were some of the recommended features by the people we interviewed to set criteria for quality of specimens and data for the virtual biorepository. There were some concerns about data sharing, standardizing material transfer agreements and negotiations, and emphasis on quality, both in the specimens and the operations of the biorepositories that will serve as source of specimens. Biorepositories or laboratories serving as source of specimens. And then to simplify access, and that's again what the virtual biorepository system would want to do. And importantly, building capacity and trusting in LMICs to enable equitable access to specimens and benefits. So from the concept of the virtual biorepository that I described to implementation, the next step was that we used a Delphi process to prioritize what are the most important actions for implementation of the virtual biorepository system. Next slide, please. In this survey, we focused on, we narrowed the scope to saying that the specimens that we are going to be interested to initially will be for immune-based assays only. And these were the responses, again, consistent with what we learned before. One interesting response was that preference for decentralized biorepository models. So rather than one large, centralized, expensive to maintain facility for this purpose, that having either a federated system or a hybrid system of some functions centralized and some decentralized. These were the type of specimens, again, for immune-based assays tests, serum and plasma being of highest importance, and the methods of collection were also a longitudinal need for longitudinal serial samples from confirmed cases, pre and post-vaccination, from regionally collected from known endemic diseases, and normal controls. Next, please. So the responses from were consistent with what we gathered before. What we also learned from this was an interest in kind of what would be a sustainable model, would be a the cost recovery plan would be good, and that we need to develop some equitable process that the VBS members would agree to for what would be the benefits for being members of this VBS. And then participation of the VBS in developing the policies for access and use. So the first demonstration project for the VBS was for implementation was launched in December 2023. It is a proof of concept project designated 10 by 10, and it is under the umbrella of the Contagio project, cohorts to be activated globally in outbreaks, is a name that is funded by the European Commission. And specifically what it is starting out with 10 participating members with broad geographical distribution, asked to put aside 10 large volume, at least 10 milliliters of samples from 10 donors. And the initial samples will be serum and plasma from healthy controls for reference material. So these are, again, summarizing sort of the main goals of this demonstration project, to develop overarching goal to develop a durable system. And in this demonstration project, we actually want to show that we can exchange samples and prepare characterized reference material. There is a broad geographic representation of this initial 10 members as shown on this map. There are 3 main working groups, one focusing on governance, one on benefits, and one on sustainability. In the benefits, one of the things that we want to do is for easy access, map all the regulatory requirements for each of the sites. So you could click on a site on the map and be able to see what are the things you need to know in order to get samples from them or send samples to this site. We want to build capacity and the first for laboratory. And the first test will be using PCR for different pathogens, and this is supported by European Virus Archive, and for serology from University of Colorado. Next slide, please. So the vision for the future of the virtual biorepository system is to build on this small group and through a buddy system enroll more and more and grow the organization. So to summarize, what are some of the barriers and challenges that we have identified? Locating sources of quality specimens, associated metadata, completeness of the data is always an issue. All the issues related to shipping and cold chain, knowing the regulations and cost and logistics, negotiations of material transfer data agreements, and most importantly, consistently, we found concern about restrictions on sharing specimens and the process of ethics approval. One of the other areas that came out from our original survey that in terms of one of the barriers to sharing specimens is kind of lack of understanding of what the benefit sharing portion of the Nagoya Protocol really means. So we asked this question from in the survey: does your country have a specific policy regarding the Nagoya Protocol that would prevent you from contributing specimens to the virtual biorepository system? And the majority of the respondents, more than 55%, did not know if their country had policies and how it impacted them. For that reason, we chose to focus this time on these 2 aspects of barriers to sample sharing. One is the benefit sharing that I just mentioned and how that impacts ability to exchange specimens, and then the ethics approval concerns, and especially the issue of broad consent. For the next webinar in the series, we plan to focus on governance and developing a business model for sustainability. As May mentioned, we want to do this yearly, and that will be our next. And we will focus on the benefits more in the next webinar. So I wanted to acknowledge before finishing the Virtual Biorepository System team from the Colorado School of Public Health, my colleagues, May Chu, Zoe Steinberg, Julia Poggi, Amy Price, Nikash Pasnuri, and Thomas Yenish, and many members of the Contagio team, some who are participating in the webinar today. And the 10 by 10 members that I skipped over very quickly, all these are the countries that are represented. And I will not go through the full list, but these are all the colleagues who are helping us shape the virtual biorepository system. They are helping us develop the governance for it, define the benefits of being part of this system and how to grow it. Thank you very much.
Thank you very much, Judith. And now the floor is open to have a few questions specific to clarify some terms of the presentation of Judith. There is a question: if a country has a restriction on sending a specimen outside of the country. Can they participate in the VBS and how?
So the answer to that would be that yes, they could participate. And what we would do in that case, if they cannot ship the samples outside of the country, is send them the kits for testing.
Thank you. Thank you very much, Judith, for the great presentation. And we will follow with we are now continuing with the Dr. Rebecca Katz, PhD and MPH. Dr. Rebecca Katz is a professor at Georgetown University Medical Center and School of Foreign Service, and director of the Center for Global Health Science and Security. Dr. Katz will provide a brief overview of the global and national governance regimen for cross-border diseases surveillance, including samples and information sharing, including the Convention on Biological Diversity, Nagoya Protocol, national level laws around access and benefit sharing, and ongoing negotiation in Geneva. Dr. Rebecca, please go ahead.
Hi, hopefully you can hear me all right.
Yes.
Great. So delighted to be with all of you to talk about access and benefit sharing. And it's, I have to say up front, it's one of the most complicated and kind of bureaucratically weedy areas of global health security, but also one of the most important. So I don't actually know the expertise of everybody who's on this webinar, but it appears that there are some people with incredibly deep expertise. So I apologize in advance if some of this is very basic. If this is very basic to you, just stick with me a little bit until I get to the last couple of slides, where hopefully presenting some work that will be of direct use to all of you. So let me start by saying this field is continuously shifting and some of the nomenclature changes. But I always start by talking about sovereignty and the language of viral sovereignty. And just reminding everybody that under international law, states are sovereign and they have the right to govern everything within their borders. And that nations have extended this concept to genetic resources, including viruses. Thus the terminology of viral sovereignty. Next slide quickly, please. Thanks. Now, there's a lot of ways to approach this. On the policy and governance side, there is a complex web of governance tools for all types of issues related to emerging infectious diseases. And it ranges from international agreements to regional to national level policies, strategies, regulations, laws, and then the actual implementation of those laws and regulations nationally and subnationally. Importantly, there is supposed to be a link between the top of that triangle and the international agreements down to those national policies and implementation. It doesn't always work that way, but this is how it's supposed to be structured. And what I want to do is actually the left of this slide gives you some of the world of the international agreements that are addressing this specific topic. So if you'll very quickly, what I'd like to do, and if we can go to the next slide, is review where the most relevant international agreements are. So we start with the Convention on Biological Diversity. It entered into force in 1993. The point of it, and this was born out of the 1992 Rio Earth Summit, was around, it was conceived as a tool for protecting biological diversity, right? And the point of this was to protect the resources within each nation. Now, part of this agreement, and if you go to the next slide, please, was Article 15. And Article 15 of the Convention on Biological Diversity articulated that states have the rights over their natural resources. and that they should endeavor to facilitate access to those resources. Now, the next slide moves on to say that it is an obligation of every country who's a party to this agreement to facilitate access to those genetic resources based off of mutually agreed terms and with prior informed consent, and to do this in a way that's fair and equitable. So basically what CBD does is spell out this access and benefit sharing. At the core, this international agreement says you can't steal stuff from countries. And if you want to have access to things that are in countries, you need to have you need to engage in the system. You need to engage in a transparent, equitable system in order to facilitate those access and benefit sharing. So next slide. Another really important article here is Article 2, which explains like what is a genetic resource. Now, again, if your eyes are glazing over a little bit, that's okay. Stick with me, I promise. But but just to say here that, if you read this, you're like, well, actually, yeah, this does actually apply to pathogens in the way that we conceptualize them. Now, if you go to the next slide, I do want to say, like, what is access and benefit sharing as it's defined in this space? Access is, could be unlimited access, it could be non-commercial, it could be commercial. On the benefits side, it's really anything that links to the use of that resource. So it could be monetary, right? You could pay a country for access to a resource. It could be lump sum, it could be royalty, it could be non-monetary, right? So there could be sharing of research results, there could be collaborations, cooperation, participation, knowledge and tech transfer, capacity building, contributions to a local economy, favorable licensing terms, all sorts of things. And the way that this plays out, next slide, is that access and benefit sharing could either be facilitated directly between the country that has the pathogen and the potential user of the genetic resource. And again, this should be done through prior informed consent and mutually agreed terms and creating almost like a contractual agreement between the country and the potential user. The other way that this is done, next slide, can be through an intermediary, so like a multilateral facilitator. Again, it's done both ways. The International Treaty on Plant Genetic Resources for Food and Agriculture, they use a multilateral system for this. Next slide. Now, the thing that most people have heard of, and it was referenced in the first presentation, is Nagoya. Now, Nagoya is a negotiated protocol of the Convention on Biological Diversity. And it was really intended to clarify what that Article 15 said. Like, how does this really relate to genetic resources? And this came about at a time when there was a lot of discussion around rival sovereignty, and countries were trying to figure out what does this all mean, and how do we look at the social justice aspects of sharing pathogens. But at the core, what Nagoya says is it reiterates that yes, states parties for the Convention on Biological Diversity really did mean viruses when they said genetic resources. And Nagoya goes on to spell out a whole bunch of things. And if you go to the next slide, without getting into article by article, and again, if your eyes are glazing over, I give a 2-hour lecture on this, and I'm happy to anybody who wants to dive in article by article in Nagoya, I'm happy to set up a separate time and talk about it. But basically, at the end of the day, the world has become relatively divided on how they feel about Nagoya. On the negative side, there are some that worry that Nagoya really slows everything down, and they aren't really sure what it means, and they're unclear what the national authorities are, and they feel it's really onerous to do, say, material transfer agreements for every pathogen transfer. And there is fear that researchers will be really annoyed by the amount of paperwork or the kind of the regulatory requirements. On the positive side, though, there one could argue that by creating this system, it actually supports a more equitable system. It means that you actually have to clarify what you're doing, that you are putting everything on the table, that you're going to access stuff, that the country or the researchers who might have spent a lot of time collecting samples actually get acknowledged in a place where they might not have been acknowledged before. So there is it is actually relatively balanced, and depending on where you are in the world is whether you are more on the side of this is a really good thing that protects all of our rights versus this is just an onerous thing that we have to deal with. So if you go to the next slide. Now, added into this mix of international agreements, there's also the Pandemic Influenza Preparedness Framework, PIP, which sets up basically an access and benefit sharing system that is just for influenza strains of pandemic potential. But again, you can look through the articles, and it starts with recognizing the sovereign states' rights over their biological resources, and then talks about this framework for access and benefit sharing. And for those of you who are deep on PIP, you will know that there are all sorts of standard material transfer agreements that are used to facilitate the movement of pathogens. Next slide. And it we keep adding on, right? There's in the process to update the international health regulations over the last couple of years, that was with the amendments that were agreed to on June 1st of this year. There is new language that has been added on health products, and what that language says in the revised IHR is it requires WHO to facilitate equitable access. Now, I will say it's not entirely clear how that language will be operationalized, in part because the folks who are adding the language to the IHR were trying to do so in a way that would be consistent with any new language that emerged out of the international intergovernmental negotiating body, sorry, for the new pandemic agreement or treaty. Next slide. Which is the group that has been meeting and discussing, what should or should not go into a new pandemic treaty. If folks are tracking this, there's been a lot of effort and work, and it's going okay, not great. And one of the reasons it's going not great is because of the next slide. Very much this issue of access and benefit sharing. It is it has become the most contentious area of negotiating the new agreement, and a pretty stark divide between countries that want unencumbered access to pathogens and mostly lower middle income lower middle income nations who are very much focused on the benefit side. What do you get for getting access to our pathogens? This again remains one of the most contentious issues. It will probably, and it's hard to say what will really happen with this agreement, but most likely be kind of punted off into a separate protocol negotiation to try to sort out what this should look like and how it would then link to Nagoya, to the IHR, to PIP, to that whole world of international agreements. Okay, next slide. Now, if you zoned out, this is the one that you should come back for. This is probably the slide that is most useful to you all. Over the course of the past year, our research team has tried to create a database, actually, of every single country in the world's laws and regulations and policies related to access and benefit sharing. So if you are one of the people that responded to the survey and weren't sure what your national laws and regulations were, I invite you to go. There's two links on the bottom of this slide. One is to a website, which is ampeid.org, and you can look at the access and benefit sharing topic. The other, if you just want to play with the data, is a link to our GitHub, which stores all the data. Or if you just want to read the summary, there's a link above to the preprint, actually, of the paper that we wrote on this. But what we have done is we have gone country by country and captured all the laws and regulations that are relevant to ABS. Now, if you go to the next slide, I can tell you up front that we have found that there are 104 countries in the world that have legally enforceable policies on access and benefit sharing. There are 92 countries that have explicit policies relevant to microorganisms. There are 74 countries that have chosen to restrict access to their domestic pathogens. And there are 53 that have explicitly chosen to link access to pathogenic resources with an obligation to share benefits. There are another 60 countries that have a codified position on digital sequence information or sharing genetic sequence data. And so, and there's, and those laws and regulations really vary around the world. So again, if you are one of the people who weren't sure what your national laws are, we invite you to go in and to dig around on this and to play with that data. Two more slides and I'll wrap up here. I think the next slide. Just to note that you know, it gets messier and messier as you think about it, but there are again, a lot of you on this call have deep expertise in this space, but there are a bunch of pathogen specific networks that have their own system for how they're sharing information. And this gets particularly complicated when we think about genetic sequence data. But you know, these don't always link back to what those national laws and regulations are. So I imagine it's going to be kind of a busy time over the next couple of years as some of these things get deconflicted and sorted out. And then finally, the last slide I have is that if this is a topic that is of deep interest to you and you wanna go very deep on it, several years ago, pre-pandemic, we held a conference on this topic and then ended up in the middle of the pandemic publishing an edited volume. It's called Viral Sovereignty and Technology Transfer. I will say though, in an amazing turn of events this week, one of my colleagues ordered this book, and whoever was doing the printing for Cambridge University Press had some very odd thing happen where when they received the book, when they opened it, it was actually half the book was a children's coloring book. So if you happen to purchase this book and something like that happens to you in the printing process, please let me know. It will become a collector's item. So with that, I will stop my presentation. And again, I'm happy to answer any questions, or if anybody wants to set up a separate time to talk about some of the details of some of these agreements, I'm happy to do so.
Okay, thank you very much, Dr. Rebecca, for this excellent conference. We have two questions. One is if you can clarify if only viruses of all microorganisms and that comport with exchange observed.
So it depends on the country, right? I mean, I think that I think there is, you know, we could go into a deep, like, kind of philosophical discussion around what is in the international agreements, but most important and relevant for this network probably is the national legislation and policies. So again, I would encourage you to dig in and read the data set that we have actually includes the text of the policies, the legally enforceable policies for every country. So you can go in and actually read it in the original language.
Okay. Okay, thank you. And there is another question is if a country is not signatory to the Nagoya Protocol, what is their responsibility regarding specimen sharing?
Right. So first, I believe every country at this point except the United States is a party to CBD. There are fewer countries that are party to Nagoya, but again, this is where it's critical to look at the national level laws and regulations, right? Which in many cases could be the implementing legislation under Article 8 of Nagoya, or it might just be the way that the country is interpreting their responsibilities under the Convention on Biological Diversity.
Okay, thank you very much. There are more questions, but we will have the opportunity, you will have the opportunity to answer in the special session devoted to, after all presentation, we will have a dedicated Q&A session for a more in-depth discussion. So we can now I have my pleasure to introducing you Dr. Lauren Maxwell. Lauren is an epidemiologist, data scientist, and clinical researcher at the Heidelberg Institute of Global Health at Heidelberg University. Dr. Maxwell will discuss the role of broad consent in research utilizing sample sharing, the differences in regulations pertaining to broad consent in different regions, and best practice in research involving broad consent. Please, Lauren, go ahead.
Great. Thanks so much, María Consuelo. So thanks for inviting me. And as María Consuelo said, I'll be talking about broad consents. So what is broad consent for future use of data and samples? So that's the reuse of data and or samples collected by researchers who may not be affiliated with the original study team for purposes that may differ from the objectives of the original study. And when we think about broad consent, we want to posit broad consent as existing with different types of consent, including, and I'm sorry, let me see if I can get rid of this bar here. Broad consent for future use, including the study consent and blanket consent for future use. So the study consent is where you consent participants to your study. It's specific to that study. It has a high level of ethical oversight because the ERC or the IRB that's approving your study is specifically approving the consent form for that study. And then the participants have a high level of control over the data and how the data and samples are used because they understand how the study will be run. To a large extent, that information is provided to them. Informed consent is required for most research, although not all research. And then broad consent, in contrast, allows for, so it's when you seek consent from the study participants for their permission for the data and samples to be used for future research within specified boundaries. So generally you specify the types of research, and they can be loosely specified, but you put some bounds on the types of research where their data and samples will be reused. And there isn't a high level of ethical oversight for broad consent for future use because the statement is included in the study's informed consent templates, but then at the time that folks consent to the study, the ethics review committee doesn't necessarily know what all the different types of future uses will be, but then those future uses generally have to so the future users of those data or samples generally have to seek ethics approval for their reuse of the data and samples. So the participant has some measure of control, and generally they will be given an opt-in or an opt-out for broad consent for future use. So it's not assumed from their consent to the study. But they don't, and they won't necessarily know how those data and samples are being used. And then in contrast to broad consent, we have blanket consent. So blanket consent is when researchers ask participants to allow for the unrestricted future use of data and samples without additional oversight. So this is the broadest way that data and samples can later be used, and it's generally not recommended. So when we consider crafting the language for a statement asking for broad consent for future use, we put some boundaries on that language rather than leaving the language very broad. And then blanket consent doesn't give participants really control over how the data and samples are reused because they don't prospectively know what the different potential uses could be. And as I mentioned, blanket consent is generally not recommended, but broad consent for future use is often recommended to maximize the utility of the data and the samples that we collect from research participants. So there are a number of ethical guidance documents that refer to broad consent for future use and suggest that researchers use broad consent for future use because getting consent at the time when folks are consented to the study, so getting their consent for the future use of data and samples is really best practice. And a way around that for folks who did not get broad consent for future use from research subjects is through what's called a waiver of consent. And I won't get into that, but a waiver of consent is a formal application process to an ethics review board to enable the data or samples to be shared in the absence of having gotten broad consent for future use from the study participants. So when we think about these different guidance documents, including the SIOMS 2016 guidance, the OECD guidelines for human biobanks and genetic research databases, the GDPR and UNESCO, we see that specifying governance mechanisms, it becomes important. So letting research participants know how decisions around the future use of data and samples will be made. And then SIOMS at least suggests an opt-out. So an opt-out is where participants are given the choice at study consent to opt out of the future use of their data and samples. And how do we know if we got broad consent right? So one thing that May had asked me to talk about is, what are your specific recommendations for language on broad consent for future use? And that's a lot to fit into a presentation, but what I will talk about today is our kind of review of the literature of best practice for broad consent for future use, and then also some primary research that we've done to try to understand community perspectives on broad consent for future use of data and samples conducted in collaboration with my colleague María Consuelo, who's leading this call. And so I'll talk briefly about the results of a scoping review we did, a qualitative study that we conducted with ERC members in Colombia, broad consent for future use, a cognitive interview study to understand whether research participants were actually understanding the language and broad consent for future use, and then a quantitative survey of infectious disease cohorts participants' attitudes related to sample reuse in Nicaragua and Colombia. And I'm going to go through these very quickly. So I've put the citations to the existing published articles, and I'm happy to discuss any of these at a later time. So in terms of the scoping review, we looked at 48 articles. And what we found is that most of the studies that discuss in any way broad consent for future use of data and samples suggest that researchers engage in community engagement, but community engagement was rarely to almost never done, and it wasn't clear how. There aren't clear guidelines on how researchers should engage communities to understand their opinions on broad consent for future use and how that language should be crafted. One thing that's important to keep in mind is that communities don't think about all future users or uses equally. So participants' support for broad consent for future use can vary by whether or not the future user is a commercial group or a public health agency or a nonprofit or academic group. We saw that across studies that related to broad consent for future use, there were concerns related to the governance of sample sharing, but those concerns became less pronounced when samples were shared locally. So different stakeholders showed more support for local sample reuse rather than, sending samples outside of the country. There was a need for transparent and clear governance to retain research and community trust in the context of data and sample sharing. And then we saw from our broad review of the literature that there was a general lack of understanding of the language of broad consent for future use. So in studies that looked at this, they found that participants were not likely to well understand the language in the consent form related to broad consent for future use. And one finding was that biobank participants might believe that they could directly benefit from sample reuse, which is a misunderstanding. And then we also found age-related differences in folks' different stakeholder support for broad consent for future use. Specifically, that older participants were more likely to trust the research enterprise, but younger participants were more likely to support and engage in genomic research and were more concerned about their privacy. And then when we think about the body of research related to broad consent for future use and recommendations, we're really considering a very highly selected population with low response rates. So we don't well understand different communities' perspectives on broad consent for future use. And then oftentimes participants had difficulty understanding the questions related to broad consent for future use because it is such a difficult to understand concept. So one of the things that we did in our research group was to conduct a qualitative interview study with ethics review committees in Colombia. And we interviewed 24 participants from 10 ethics review committees. And the goal of this was to understand their concerns when they evaluate research protocols that include broad consent for future use. And what we found is that, and I've just included here some quotes to illustrate these points, is that ethics review committee members were concerned that the consent forms were not sufficiently clear. They were concerned that broad consent was kind of approaching blanket consent, so that broad consent could look like a blank check where there just wasn't enough detail given to allow folks to make an informed decision or to put those guardrails on the future uses, as we talked about before, in terms of the difference between broad and blanket consent. And then folks were specifically concerned about sample sharing and that biorepositories could be used to kind of conduct research that the community didn't support. So they wanted to better understand what types of research would be conducted with the samples. And they really wanted to have a clearly specified governance structure. So what that means is that the structure and the way the criteria used to make decisions around sample reuse are clearly specified so that research participants can understand that when they are agreeing to broad consent for future use. And then in keeping to what the other speakers have said today, the ethics review committee members from Colombia were very concerned about benefit sharing and wanting to involve the community. So when participant specified that they wanted their community to not be seen as a sample dispenser. So this concern about extractive research came up quite a bit. And then people felt that there needed to be community education and community engagement around the importance of sample reuse. And one thing that did come out, because we were conducting this research during the COVID-19 pandemic, is that samples can be seen as a public good. So something that belongs to everyone and something that can be used for the collective benefit of everyone. But when we look globally at the findings of that research, we see that ethics review committee members were pretty clear on when broad consent for future use was warranted, and part of their support for broad consent for future use was related to applications that would show a clear benefit for society, applications where the governance structure was clearly described. They were more supportive of academic rather than for-profit use. And then they were unsupportive of blanket consent, so they really wanted to have guardrails on consent and for it to be broad rather than blanket consents. And they wanted to see the community engaged. So we also conducted what's called a cognitive interview study with infectious disease cohort participants in Nicaragua and Colombia. And what we did here was we tried to understand to what degree are folks who participate in these research studies understanding the template consent forms that are often used with research participants. So we took a template consent that was recommended by the Berkeley Institutional Review Board. We translated it into Spanish, and then we assessed the understanding of that consent form. And what we found was that the broad consent related language in the university mandated informed consent form was not well understood. So the consent form obviously involved a number of very complex topics that were not well understood by the community. And some of the important misunderstandings that we found were that participants often didn't understand that they wouldn't be informed about the future uses or users. So by giving broad consent, they wouldn't then later understand which studies had used their samples or how their samples were used. And then this consent form included a consent for the reuse of genetic data, and that wasn't well understood. So it's obviously a complex topic that needs to be explained in a way that's accessible. And then again, we found in our literature review, or the scoping review, I should say, that there was an expectation that sharing data or samples would benefit their specific case. So obviously people were concerned about their specific case or their children's case, and they expected that the samples would be returned to them, or sorry, the results would be returned to them. And to that end, they also thought that incidental findings would be returned to them when the consent form said that these would not. And one of the important findings was that trust in the research team and the belief that sharing data and samples could lead to new vaccines or treatments were the main drivers behind participant support for data and sample sharing. And then we also conducted a quantitative survey on biobanking attitudes with ID cohort participants in Nicaragua and Colombia using what's called the Banks SP, which is a quantitative survey of biobanking attitudes that had already been translated and piloted into Spanish. And one of the interesting findings from that work was that we found that people who had a higher knowledge of biobanking had more supportive attitudes towards biobanking. So it kind of leads us to believe that educating and engaging with the community can lead to the community support for sample collection and sample sharing. So when we think about this research in collaboration, or in conjunction, so our own primary research and then also a scoping review of the existing research on broad consent for future use, there's some key takeaways. So one is that one size fits all approach to broad consent for future use doesn't work. So we really need tailored approaches to the language for broad consent for future use. Both ethics review committee members and research participants are concerned about broad consent for future use, and they support the reuse of samples, but they want to better understand the governance, and they want a higher level of community engagement, and they're concerned about actual benefit sharing. And then the lack of understanding of the broad consent for future use clause in the informed consent is a concern that needs to be addressed. So ethics review committee members and the research participants themselves said that they would prefer that researchers pre-specify reuse purposes, so give a clear list of how the data or samples could be reused, that they clarify the structure for data and sample governance, and that they also ensure that participants understand the language around broad consent for future use and engage the community. And then again, if we go back to our original question, which is how do we know if we got broad consent right? What we need to do minimally is to seek broad consent for future use. So it's very important to ask the participants themselves whether they support the future use of their samples and data. And then we'd like to, at a minimum, I should say, we want to pilot test the broad consent language. So we want to have a good idea of whether or not that language is working in our population, we need to provide an opt-out. So we shouldn't assume that if someone participates in the study, that they're agreeing to broad consent for future use of their samples and their data. We have to consider benefits sharing and address the risk of extractive or parachute research. We need to ensure specifically that clauses on incidental findings and the expectation of direct benefit are clarified, because these have come up again and again when folks are asked to share their samples. There's this expectation that they may have that may not be clarified in the consent process. And then there has to be a pathway for them to withdraw their consent. And we should describe some basic aspects of governance. So an example is that we could say that studies that reuse the data have ethical review. And then it would be helpful if we use something called the data use ontology, which is a way to structure the consent such that we have some interoperability across consents and we can understand whether or not future use was agreed to, and then future use by which types of groups. So is this future use only by non-for-profit groups, or could it be future use by commercial groups? So Duo breaks that down and is a nice way to structure your broad consent for future use related language. And then if we want to do better, we could better describe the governance process and the consent. We could conduct a cognitive interview study to really understand whether participants are understanding the key concepts in broad consent. We could do community consultation around benefit sharing and broad consent for future use and their preferences for the reuse of samples and data. And then we could also include community or research participants in the governance. And these are just some links to some of the papers that I've talked about here. And I'll end with some acknowledgements. So this is the team that has worked together to produce this research, which has been funded by a number of different groups. And thank you very much. Take questions.
Hey, Lauren, thank you very much. We have over time got this, so maybe there are a lot of questions for you also, and also for Rebecca. And but we have the last presentation, and then we can have the Q&A session to go in depth for each of the presentation. So finally, to close this exceptional panel, I'm very pleased to introduce Daiane Sertorio. She is a biology master's in science from the University of Sao Paulo, an extensive experience in biobanking and research ethics, currently serving as an executive coordinator for the Fiocruz Biobanking Network and contributing as an external representative in the development of Brazilian biobank regulation updates, fostering ethical advancements in clinical research and innovation. She will present a case sample of the Fiocruz Biobank Network, infectious diseases biobanking, pitfalls and solutions. Please, Daiane, the floor is yours.
Thank you. Thank you for the introduction. Good morning, good afternoon, good evening for everyone. Thank you for the opportunity to speak today about the Fiocruz Biobank Network. In my presentation today, I will talk, next slide, please. I will talk a little bit about the Fiocruz institution, the Fiocruz Biobank Network, and also a little bit about the Brazilian regulatory landscape, the barriers and solutions for sample sharing, sample and data sharing. Next, please. So Fiocruz, the Oswaldo Cruz Foundation is a leading institution in public health and biomedical research in Brazil. For over 120 years, it has been the forefront of addressing infectious diseases through innovation, research, and the development of public health policies, while also providing care for patients with neglected diseases in outpatient clinics and hospitals. We have over 10 technical units spread around Brazil and over 15,000 researchers. Next, please. The institution focuses on science, technology, and innovation for the unified health system that we call SUS. We work with national and international corporations, reducing inequality in health, education, and science. And Fiocruz is the main non-university institution on training and qualification of human resources for SUS and for science and technology in Brazil. Next, please. So a little bit about our network. The Fiocruz Biobank network has it as its main goals, providing quality samples for research in public health, harmonizing practices and protocol between the biobanks, fostering collaborations and ensuring compliance with ethical and legal standards. We work in a decentralized manner. Right now we have 5 registered biobanks and we are developing 5 new ones. And our sources of specimens are research projects that share samples for reuse, and also the collection from outpatient healthcare from Fiocruz and also from partners. Next, please. The Fiocruz Biobank network, as I said, has these 10 biobanks, 5 in operation and 5 in developing. And it's interesting to showcase a little bit the vocation about the units where these biobanks are implanted. We have units that are focused on immunobiologicals. We have units that focus on infant and maternal diseases. We have units that work with rare and chronic diseases. We have units that focus a lot on oncology. We have one of our units is also in the Amazon, so we have a lot of the arbovirus and lots of also neglected diseases in there. And we also have 2 other biobanks, one in Bahia, that is the state where we have the blackest population in Brazil, so, and also in Minas, that we have a huge diversity. So in this context, we have a huge populational diversity. Brazil by itself is a diverse country, and having biobanks in different areas of the country, we can cover the regionalities of this diversity. And about the scope, our scope is public health. Next slide, please. So about challenges in sharing specimens. There are several barriers that we can list for the sharing specimens. And we can talk about the complex and benefit sharing laws, as Rebecca told about navigating international shipping regulations, about ethical concerns and governance issues, as Lauren talked about. So we can talk about consent, as Lauren was talked about, and talking a little bit about solution for these barriers. We need to stop the establishment of partnerships and alliances is a good way to remove those barriers from the way. And the development of streamlined legal frameworks also help on removing those barriers. And also the existence of digital systems for sample tracking and consent management is also a good way to remove the barriers from this process of sample sharing and the testing of new technologies, new diagnoses, new medicines. So these are some techniques for, these are some processes, not techniques, because it's a lot of work on that. Next, please. So entering the Brazilian regulatory landscape, here we have a new law, the law number 14874 from 2024, that talks about human research. So this year we had the publication of this law that unified basically all the regulations that we had over time. I don't know if many of you know, Brazil has I think, the biggest ethical system in the world. So this was a way to fortify the system. There's also some fragilities, but as we know, the legal process always brings benefits and also fragility. So it's an advance. And also we have the law number 13/123 that that talks about the access and benefit sharing of pathogens specifically, but also all of not just pathogens, but all biodiversity. So these are the laws we have about that. I will talk a little bit in detail about those. But we also have in action the resolutions and ministry orders that we have prior to the publication of this law. That verse is about biospecimen research, human research with in bioscience, and research with foreigner execution or participation, just to give a little briefing of topics that we have in our regulations. Next, please. So about biorepositories and biobanks in Brazil, in our regulation, we have a difference in the terms. We call biorepositories and biobanks different forms of sample storage. For biorepositories, we use only specific consent. That's what Lauren told us about study consent. So in this kind of consent, you have the authorization to use only for that study that was approved from an IRB, that here in Brazil we call Ethics Research Committee, and we use the words CEP as a short way of calling them. Also, the biorepository have a time duration for the storage that is limited to the duration of the study, or up to 10 years if the study needs to use that samples in the future for checking or for anything related to that study. So after this time, the end of the study or the 10-year period, the samples can be transferred to another biorepository or to a biobank, or to be discarded. When we talk about biobanks, we are talking about different kind of consent. So in a lot of places, you can have a unique consent for the study and to store the samples and the reuse of it. Here in Brazil, we need two different consents. And the consent for biobanks allows the participant to manifest their autonomy and deciding if they want to give broad or specific consent. So they can mark that on the consent and choose if they want to authorize every study that uses their samples and data, or if they give broad consent in the scope of public health. And the samples is stored on biobanks. They are shared with approved projects. So biobanks in Brazil can only share samples with research projects that has an IRB approval. And there's no time limit for the storage of the sample. The only limitant is the quality of the sample, and later on you also have the data. And we have on biobanks the need of, we have a feeding cycle that every researcher that uses that samples and those data, they feed the biobank with the data they produce. So it increases the knowledge and the data about those samples. Next, please. So about our regulation, when we talk about sharing samples with other countries, we have two conditions. First, I will talk in a way that we literally ship the samples to another country to use. In this sense, we will need ethical approval And that ethical approval needs to happen in the IRB of the origin of the study and also in the local IRB from where the samples were collected. So we need a Brazilian approval. And for that approval, we need that project to be submitted by a local researcher. So it induces the establishment of partnerships. And in this partnership, there's the need of submitting declarations of compliance with Brazilian law and regulations. Between the laws and the details that needs to be complied with, we have in Brazil, the sample is from the participant, the researcher, the institution, they don't own the samples, they are just the guardians of the sample. And it is forbidden to patent human samples and also some biodiversity samples too. We have the rule of defining the benefit sharing on this agreement, on this initial agreement. As Lauren said, it can happen in different ways, but it needs to be established before the researcher happens and the samples are shared. And it needs a declaration of use of that the samples that are shipped will be used only for the approved study. It cannot be used for any other purpose. So and we also have to specify what are the budget sources if there is if there is only one institution funding the project, if there are many, if the Brazilian institution that are working in that is also funding. So it's important to know to avoid that if only the foreigner institution is funding the project, to avoid to have an imbalance between the researchers. So this information is may seem not important, but it gives a lot of information about the relationship that is formed in the partnership. Next, please. So, but also, as Lauren said, there is we often involve researchers in a way that the sample doesn't need to be shipped somewhere else. The samples can be used in the country. We have infrastructure, we have good researchers, we have good labs. So in this way, the partnerships can be established. In this way, the ethical approval is simpler. The submission of the protocol involves also the presentation of the partnership, but the logistics is often simpler in this way. So next, please. So just to showcase the work of Fiocruz in the partnerships and scientific production, here we have a map from our observatory showing the countries with which we have partnerships and scientific production with. So there are very few countries in the world that we had never contributed and made partnerships with. So Fiocruz has a very strong relation and tradition in partnerships in research. Next, please. So just showcasing a few examples of these partnerships for the development of vaccines and diagnostic tests for infectious disease and drug testing with international research institution. We have the collaboration for the Zika virus research. That was a big project funded by NIH, and that comprised several countries, and Brazil was a main contributor to that. And in this case, the samples stayed in the country, but there were a centralized data analysis. And in the second example, also showcasing the Fiocruz partnership, we produced COVID vaccine for the pandemic to supply not just Brazil, but several other countries. And not just producing the vaccine, but also funding and realizing studies for the use of the vaccine during the pandemic. So these are some examples. And as a takeaway, just because my time is over, I'm sorry. And I would highlight the importance of the reuse of biospecimens and data since they were collected, especially when we talk about neglected diseases that are collected from vulnerable populations that are often isolated in places that are hard to collect, and the expenses for getting there is high. So the reuse of that is something that should be encouraged. And the importance of ethical and regulatory frameworks in global partnerships and the compliance with those frameworks is something that's really important. So next, please. And in this way, I end my talk. One more, I'm sorry for the animation. And thank you all for your time. And these are our contacts, my contact, and the contact for the network in our websites. And I know that we don't have time now, but I'm available for questions later.
Okay, hi. Thanks very much. I'm Amy Price, and I'm working to facilitate the discussion, except our speakers were so rich, we don't have time for discussion. So what we're going to do is we're going to collate all the questions, get the answers, send them out to you, and also invite you to respond to the responses, and we'll make that available to all our participants. And so right now, with only a couple of minutes to close, and it's been like such a pleasure. I've learned so much myself from all these speakers, and I can understand about the questions because I have so many bubbling up myself. And so it's been a great meeting, and I'd like to turn this over now to Zoe to help us to close out, please.
Great. Thank you so much, Amy, and thank you to all of the speakers, as well as María, Consuelo, and Elena Ray for your facilitation of the talks. It's been a very interesting hour and a half. With that, I'm going to share just a few more brief slides. Great. So with that, I just wanted to show a brief diagram of just how many people registered for this webinar. So thank you all so much. As you can see, we had 300 total registrations for this webinar, with a very large number of countries represented. So thank you so much all for your attendance. And with that, a few final items. Again, thank you for your attendance, insight. Sorry about that. Insight and engaging questions throughout this webinar. It's been an absolute pleasure. Thank you as well to the Global Health Network, specifically Adam Dale, Danielle Morelli, and Louis Karasinski-Stanley for their work in making the webinar possible. As well, big thank you to Judith Giri, Rebecca Katz, Lauren Maxwell, Daiane Sertorio, María, Consuelo, Elena Ray, Amy Price, and Mei Chu for their expertise and experience over the course of the webinar. Just a few last quick items: the edited recording from this webinar, as well as the slides and the questions and the responses will be posted to the Virtual Biorepository Hub in the coming days. You can become a member of this hub by using the QR code in the slide or by following the link here. And lastly, if you have any questions, comments, feedback, concerns, please don't hesitate to reach out to us at the email address listed here, vbiorepository@ucdenver.edu. These will be included when everything is released as well. Again, thank you all so much for your attention and engagement throughout this webinar. It's been an absolute pleasure. And with that, yeah, I will turn it over.
Well, thank you very much for all your participation and the conferences, the excellent panel that we had.
Dr. Mei Chu, would you like to close with anything?
Thank you very much. I know we have so many questions and it's very content rich. So please copy the email address for TGHN that we have posted and come visit us, and we will post those questions. We'll make sure that those questions that you post and asked to be replied to and post them within the next week or so. And then we hope you stay with us. We also posted the biorepository at ucdenver.edu as a link for you to stay and connected with us on this. We will have more webinars in the future, and we hope you join us. Thank you so much for your time.
Thank you. And thanks to all our wonderful speakers. Yeah, thanks so much.
Bye.
Bye.